Good morning to you. Happy Good Friday. Fridays, we have Lifestyle Friday, and today is no exception. Our lifestyles have been changed, whether we like it or not, because of the COVID-19 pandemic. A lot has been happening. Now we are wearing masks. We are washing hands like, 15, 16 times a day. I was joking with a friend of mine from Western Kenya, because I'm also from Western Kenya, and I was telling them, this thing is confusing us. Tunanawa na hatukuli. It is becoming confusing for some of us, but it is what it is. Our lives have changed. And today we want to look at this whole pandemic from a doctor's perspective. We've been hearing from one another. We've talked to mothers and fathers and kids and all that, pastors, and how they're handling this. But we are yet to talk to a doctor. So this morning, I'm so glad to be joined by Dr. David Githanga, who is a pediatrician, cardiologist, and public health specialist. It is good to have you in studio.
Thank you, Pastor James.
Karibu sana.
Asante sana.
I'm just wondering, has life in the hospitals changed? Because hospitals are usually a very busy place. People are coming in, they're sick. But now we have this pandemic that's sweeping the globe. Has the atmosphere and the daily activities in hospitals changed?
Yes, and greatly so. First of all, just to mention that hospitals are places where you get treatment,
Yes.
but also where you can get infections. Yes, because that's where you concentrate all the unwell people.
Yes.
But when you have an airborne infection, which cuts off a lot of people from coming, first of all, the corridors are less crowded than before.
Oh.
So you have much, we haven't opened our clinic for the last 3 weeks. It's the third week.
Wow.
So we have an atmosphere where we have fewer people. Then number two, we have a lot of fear. You can see it in people's faces.
Yes.
I mean, we usually the way when you work in high-stress centers or high-stress situations, people tend to be very close and tight and they chat and whatever. But now, distancing, social distancing,
Yes.
thinking, supposing you're going to infect me, you actually work at the casualty and so on. So there is suspicion
Yes.
that you're a frontline worker. How do I know that you're not going to be infecting me? Patients. We work with children. Patients could potentially infect you. So there is that bit of how do I empathize and also ensure social distancing.
Yeah.
So there are all sorts of issues. So paranoia, if you like, fear, worry, concern. So the atmosphere has changed, and probably for a fairly long time.
Okay. When something like this happens, because now this is something, like we said earlier, is affecting the whole world. It's affecting us as a nation. What happens in the medical field? You know, does the government rally all of you guys together? Are you given information? I'm just curious to know what happens behind the scenes for those who are medical practitioners.
First of all, there is, I think this thing is new to everyone.
Yeah.
And everyone is thinking and planning on the go. So there isn't like a drill you have, like supposing there's a bomb, this is what you do and so on. We don't have those strategies yet. They're being actually organized on the go across the world. People are making protocols all the time behind the scenes. But do we have a situation where doctors are joined together and so on? I must commend the Ministry of Health and the Kenyan government for really working behind the scenes in trying to ramp up protocols very, very quickly. What do you do when you have a suspected patient who has COVID-19? So first of all is to protect yourselves and to make sure the patient does not completely become a source of infection and so on. So there's a lot of reorganization, and if you've been in some of our public hospitals, they are congested even under normal circumstances. So you can imagine a ward that's designed for 40 people, it has 60, 70, 80. How do you isolate them? And some of the patients in level 5, level 6 hospitals, so the big hospitals, have been there for a long time for chronic conditions. How do you manage them in the background, against the backdrop of highly infectious disease? So there's a lot of reorganizing and a lot of thinking and a lot of specific, site-specific planning that you may not be told from centrally what you're going to do. So there is a lot of expectations to think. What are the shortcomings that you would have? It's really supply of things like masks. If we want the doctors who are the front line to have the masks, you can't use one for the whole 8 hours or 10 hours. So supply of merchandise and stuff that you need is a challenge. it's a challenge even for places where they make them, let alone us who need to import them. So we have challenges, and we have to probably exercise grace and understanding even as we try to cope in the situation we find ourselves in.
Okay. I'm just wondering now, when you have a situation like this, it's a pandemic, are all confirmed cases being taken to one place, or are they scattered in different hospitals? How do you handle something like this?
First of all, remember that the patients who have COVID-19, 80% of them would be asymptomatic.
Oh.
That means they are like you and I. And they are walking around, they may have a little cough, have a little bit of allergy and so on. My sinusitis acts up from time to time. So they'll be like you and I. They are not anywhere, or if they are relatively unwell to come to the hospital, they may just have their usual allergy or their usual asthma and so on. But they could also have other viral infections, including COVID-19. So you have to be able to identify who are the patients who have respiratory illnesses, remembering that the commonest cause, basically globally, that makes people go to hospitals are issues related to upper airway or lower airway infections. Children even much more so. So there is what we are calling now triaging fairly quickly to try and separate people who have respiratory symptoms to fast track them quickly while ensuring social distancing so that you make your diagnosis fairly quickly. To make a diagnosis of COVID-19, you need to be able to do some swabs. The nose, and the back of the throat, and that we have had limitations in the past of the testing kits. Who do you test? You can't test everyone. In fact, ideally, it would be nice to test everyone, and then you're able, but you can't do that. That's not possible. But you have what we call high index of suspicion. Have you had contact with somebody who has recently traveled? That now has become a little bit different now that we have. We are now transmitting within. Nobody is coming from without. It's Things on the ground are a little different, as they say these days. So there are challenges and changes and thinking on the go, as I said. If we're going to cope with shortages of equipment, how do you protect the people who are at the forefront and so forth? People who are, say, anesthetists who basically have to intubate patients, ENT surgeons who deal with the airways and so forth, pediatricians for whom examining the ears and nose and throat is a standard routine. Those ones tend to get a bit more exposed and so forth.
So, for those of us on this side of the veil, we can only get information through the media or from hearsay or from, different sources. And in fact, there was a time a few weeks, was it last week or the week before, people were saying, mbona hatujaona hata mtu mmoja yuko na hii kitu? Mbona hata hatujaona mtu mmoja amekufa? That was the conversation. I talked to my mom this week, Monday this week. My mom is in Western Kenya. And my mom was saying, even people here are saying, oh, this thing is not real. It is just the government trying to scare us and to get money from us. So for you as a doctor on that other side of the veil, how seriously should we take this thing? Because I find that we are becoming a bit careless in some spaces. It's
unfortunate that we have to wait to see a sick person or a dead person for us to begin to act. But I think that you do not have to wait to see the number of deaths that have occurred in the more prosperous part of Italy for us to begin to act. Seriously, we cannot compete with northern part of Italy in terms of the availability of personnel and equipment and spaces and so on. And if they are losing even medical personnel to that extent, New York.
New York is crazy.
We cannot wait to get there because at the best of times, we are underserved. Our health systems are not as efficient as they should be. They're even less efficient where you have concentration of high numbers of people in the informal sector, informal living quarters and so on, where we are dealing with other health-related issues, water supply, sanitation, healthy food. People are locked in. Are they getting the healthy food? So we cannot wait for that time, because when that does happen, then we'll all be dropping like flies if we don't do the right thing. So I would ask people to trust. You must trust an authority in a situation like this. You must trust somebody, and it is not generally in your interest as a doctor if I'm telling you every possible thing that I'm thinking, because I induce more anxiety in you than I should. So generally we may give you truncated information or brief information or sort of watered down information, not so much to hide anything, is to stop. We also have our own anxieties. If you cough, is it COVID-19 and so on? But if I told you that, then you induce a lot of anxiety. So people have to trust authority. An authority could be a person who knows a little bit more, maybe the teacher, maybe the nurse that works around you, the clinical officer, or the doctor, or maybe a relative somewhere else. So I'd urge us to trust in the leadership that is placed there, so that we all move in a particular direction before we are all infected and basically beginning to have this sort of situation. I just heard on BBC they're beginning to bury people in mass graves in New York.
What?
Wow. We don't want that. We don't want us to
get there. Okay. Do you have any questions for us this morning? 20316 is the SMS line. WhatsApp number 0786 316 316. In studio with me today, Dr. David Githanga. We are talking about the COVID-19 effects on our medical practitioners and just looking at this whole pandemic from their eyes. It is about 23 minutes before we get to 10 o'clock. James Okumu here on Jam 316 Lifestyle Friday. Today we are hanging out with Dr. David Githanga, who is a pediatrician, a cardiologist, and a public health specialist. We are looking at the COVID-19 pandemic and its effect on our medical staff and how they are coping with this. A message here that says, Happy Good Friday, Dr. Githanga. Great to hear from you. You are my kid's doctor. And then the question is, does BCG lessen the COVID-19 severity?
Ooh, this is a parent who is reading.
Yes.
There's been lots of discussions in the media, as well as in academic areas, about whether the BCG, and the BCG is a vaccine that's given when you're born, young, for most Kenyans, in your left arm.
Yes, that mark we all
like
have.
A little mark there. That's how the police would find out who are Kenyans and who are not, because Kenyans would all have that. Other people would give it elsewhere. So BCG has been mentioned as potentially giving some sort of protection and so on. This is still works in progress. They're still evaluating. So one can tell, pretty much like they said earlier on, children don't get this, or Africans don't get this, and so on. So one couldn't go there at the moment until we have rigid studies. And by the time in medicine you're saying this is the way to go, you need to have done pretty rigorous studies to be able to prove that. If maybe understanding a little bit of immunology does help. And immunology is basically the science of looking at how your ascaris in your body, antibodies, react with the enemy, the antigens or the virus, the fighting processes and so on. The more your body has no ascaris, the weaker you are. But the more, for instance, a patient who's been on cancer treatment, or a patient who's very, very depressed because of HIV infection, your immunity is way down in the boots, so that even a simple little thing like chickenpox or a small homa becomes a big one. So if you have a situation where your immunity isn't as up and running as it should be, then you're more likely to actually get the disease, or the disease is likely to be worse off than you are. Then they're saying, if we live in situations where we are exposed to a lot of antigens, they say we live with helminths and we eat that and so on, does that protect us? So the jury is still out. There's still a lot of discussion. So I would not be asking that we rush to the hospitals to try and get BCG for that purpose. But probably in another maybe 2-3 months, we'll be able to have this information fully. I know there are some of my patients that have called me asking me if they should have the BCG. Say, I don't think we've reached a point where we can say that.
That's true. That's true. This one says, greetings. When we focus on those with pre-existing conditions, mental health is usually overlooked. What are some of the measures that people with clinical depression, for instance, need to take to avoid an episode, even with all the news going around that could cause anxiety?
I think that one cannot... You could close your eyes and pretend there is nothing.
Yeah.
The fact that the something is still going to be there even when you open your eyes means that we all will be subjected to some level of anxiety. For instance, as a doctor, I am exposed.
Yes.
When I go home, am I exposing my family to the same? If I want to go and see my aging father-in-law, at what point must I, stay far or try and call him on the phone when he'd much rather have seen me and so forth? So there are situations, we have enough situations to make us depressed, if you like. But really, depression and anxiety is related to seeing, are there solutions to this? And I think the simple measures of soap and water, practice isolation. Don't do things you don't need to do. Don't go to the shops if you don't need to do. There are things that are within your abilities to control. If we do that, we feel we're doing something. For the first time, we're being told that staying away from those that you love is actually...
protecting them.
protecting them.
Yes.
But as human beings, human contact is important. So we're being asked to do things that are not normal and so on. So will we avoid depression? I don't think we can, but we should be aware of things that could cause that. We are spending a lot of time in the house.
Yes.
We used to leaving our houses at 6 o'clock and coming back at 8 o'clock at night. We are now constantly together with those with whom we live. We are having to find a new norm and so on, which on its own can be stressful. I can imagine a mother with young children, 3 young children who are demanding
the whole day.
And they're not going to school, and you are the teacher, and you are the mother, and you are the everything, and you're the playmate. When kids ask you, even our friend neighbor is COVID also, they ask you difficult questions, and you do not know what to do with those kids asking those innocent questions. So those things are going to play to us. But I think knowing them upfront and acknowledging them upfront, and also knowing that you're not alone, should give us some sort of courage. There are also people who are prone to getting depression. Depression can be endogenous from within, or it can be caused by other things. A lot of depression we're going to be having now is reactive to the situations we are living in. Being aware and knowing that it is not possibly the end of the world, and we are finding a new norm. I'm sure things will change.
They have to.
We are learning to do meetings for large number of people just on the phone. And that's going to be the norm. You're going to have deliveries now. You don't need to go to the shops and so on. Today is a very important day as a Catholic. And you need to go for the way of the cross and a long service. We can't go. So I just got a priest friend of mine saying he's doing Mass on his own, avoiding crowding and so on. So we're having to reorient even things that are important to us and so on. And knowing that this will come to an end when we do the things we should do should be comforting enough. Having said that, people must be aware when they need to get professional services. Please get them. It's better to be told there's nothing than to assume.
Yes.
Thank you.
There's this whole issue of hydrochloroquine. Somebody's saying, I've been seeing people buying and taking hydrochloroquine for protection. Is this really safe?
No, it isn't. There's been lots of discussions about the use of hydrochloroquine, which is used for other lupus conditions and so forth. And it has side effects that are serious side effects, including interfering with the working of the heart. So really, you do not want to take those drugs without proper reasons. There are drugs we give you, and we have to carefully weigh between the benefits and the side effects. The danger of you walking to your pharmacist friend who lets you take the medication without due care is the risks you could get yourself into. You may be getting killed by the side effects of the drug,
Imagine.
so the COVID-19.
Imagine.
So I would suggest that we do not go in that route. The jury is still out.
Okay. Yeah. Okay. Let's talk about hospitals. When a hospital has a suspected case, how do they handle it? And I know earlier on when we were off air, you were talking about the importance of every facility having an isolation center.
Exactly.
Maybe you can talk a bit about that and then tell us if they have a suspected case, how are they handling it?
Well, now, first of all, you can have a suspected case, a probable case, and a confirmed case.
Those are three different
and a recovering person. People who have basically recovered and so on. So when you're suspected, have you been in touch? Have you traveled, for instance? Did you come from Wuhan or Rome or New York or Barcelona, Madrid, and other places, South Africa? You know, by just that association, you are a suspected case.
Yes.
Then do you have symptoms that possibly suggest? So when you have a respiratory symptom today when you come to a hospital, now that our cases are less imported, but now we are having basically sisi kwa sisi. What did we say on the ground?
Yes.
We are infecting each other now. You do not know who that person got in touch with or in contact with and where they may have been.
Yeah.
And remembering that 80% of the people are going to be asymptomatic. And asymptomatic means they have no issues at all.
They look okay.
They look okay. I'm infected. In 2 to 5 days, I am really throwing off maximum number of viruses into the environment. You are infectious, but I'm well. I'm even singing in the choir.
Yes.
Which you shouldn't, because then you project your voice and you push the droplets even farther.
Yes.
And we do that. You treat everyone with respiratory symptom as if they are potentially infectious. They have to be handled by people who are sufficiently kitted up.
Yeah.
They have a mask, they have a visor, and they have basically a bodysuit.
Like what we see in the movies?
Yes, exactly. And it's very frightening for children when you see children. So you are triaged quickly, separated, and then you are processed quickly so that you're not mixing with the people who are with you in that same room.
Yes.
And it means that if you're going to have all these things being done, you literally have to create a dirty corridor. A dirty corridor where anybody passing through there is well kitted up.
Yes.
But when you kit up, even as a healthcare professional, it is not just the wearing, even the removal of those clothes is something that you have to learn how to do it. Otherwise, you remove your mask by holding it at the front.
You're exposing yourself.
You're exposing yourself and then exposing the other surfaces and so on. So hospitals, fortunately, are easy to bring up to speed. And I think one of the things that the central government has done is to basically bring up this training to a fairly high level, so that what is probably falling short right now, and this is being addressed, is really making sure that we have the materials that we need. Do we have gloves? Do we have masks? Do we have the full body kit for people who are handling the patients that are risky? I've seen people wearing gloves and using sanitizers on them and then handling everywhere. Really, they are spreading. They're just spreading the infections with whatever. So gloves and hands are the same, particularly when you use the same gloves to go everywhere.
Wow. I'm just wondering, for the medical staff who are right in the mix of things, you're taking care of all these people. Do you have a support system? Because I'm trying to look at it from my perspective. I'm out here, but I am so cautious about everything. But what about that person who's actually taking care of people who are suspected or people who are confirmed as having the virus? You know, do you have a support system?
Thank you very much, James. That's an excellent question. Usually people do not think about caring for the carers. And if you're the frontline worker and you're exposed to, first of all, risky situations for your own life and for those that are close to you, coupled with working for long hours, sometimes without the things that you require, and it's probably not just doctors, people who work in the police and people who are doing services that exposes them, they have the same sort of situation. you do need a support system because you're worried. You're human.
Yeah, you're human.
Back of it.
Yeah.
You're worried, and you need a system to debrief you. And I must say that there's been a lot of effort to try and take care of these sort of workers that are at the front line. Even as you try to reduce the exposure time, which is tricky. I mean, you're there for 8 to 12 hours, and you do not want all of them being there at the same time to also ensure that you do not lose all your medical staff. Yes. So there are issues, but I think that systems have been put in place where you can get debriefing. We have a lot of burnout even as we speak, but these are works in progress. And then that awareness, I always believe in people having the knowledge, then they look for the solutions in their own context, because you say, who needs support? Do we think that this particular worker has been there for too long? Should we pull them out to take them to less stressful situation? And I think this is happening and needs to continue happening.
Okay.
So there are burnout, there are stressful situations, there are depression, there are feeling that a sheep being led to the slaughter.
To the slaughter. Yeah. I'm just wondering, with all that, how your family is taking it? Because you have to leave home every day. It's like you're going to the other day the president said we are at war, which is true. We are at war with this virus.
Yes, we
are. So you guys are our soldiers. So every day you leave your homes and you're going into the battlefield. How does that leave your family? What is going on through their minds?
I am sure they undergo through the same stress. I had a little incident where my son met a friend of his, and then he came back home and said, I think I may be putting you at risk. I'll self-isolate. I say, why? Was your friend sick? And so on. Yeah. So, but this is, again, a manifestation of the stress that can be, and this is a big man who is able to reason. Yeah. So there are stressors. Sometimes they are expressed, sometimes they are not. Yeah. They may not be expressed by younger children whose manifestation of stress may be less obvious unless you are aware. So speaking about it is important, and doing what you can within your own abilities. Yeah. If I'm called to go and see a sick patient, do I stop? But that decision of, is this serious enough for you to need to come to potentially get exposed to higher dangers, or are you likely to die of the convulsions that you're experiencing, that I need to see you now and prepare myself as best as I can. Okay. Those are now the decisions that we have to make. And I think that families of doctors are used to long hours, long absences, and so on. Yeah. The only additional thing now is highly potential agent that could be imported back home.
That's true. That's true.
So we are not different from many other people.
Yes. There has been talk of those who are now working with those who are infected, the doctors and the medical staff working directly with those infected, that they also need to be quarantined.
Yes.
I don't know what your thoughts about that would be.
If you are exposed and you have the tests done and you are positive, really you fall in the category of just like the other patients. The key thing is, are you sick enough to need to be in the hospital, or do you get isolated in the common facility, or do you have the capacity to isolate yourself where you stay? And there are guidelines now. We did do guidelines for children. If you are well, but you are virus positive, you do not need to come to the hospital. Remember, the whole issue of flattening the curve is to avoid huge numbers of people being so sick that they come to the hospital, just their numbers crash the system.
Yes.
So the whole issue is, and then there are arguments of people who say, let everything happen together and let it burn itself out. It doesn't. It doesn't. You could even cause more problems by telling people, just go onto the stadium, you'll get herd immunity. And you've had people trying to talk about herd immunity, where the more people are affected, the more they protect themselves. I think that's the wrong thing to do. The issues are about care, knowing that over 80% of the patients will be relatively well. But the 20%, 15%, 3% will be the ones that we really need care. But you don't want them needing care at the same time. How many ventilators do we have in the country?
Yeah.
Even if you had the ventilators, how many people are able to use those ventilators safely? Because you can have injuries caused by ventilator use that is not appropriate or not knowledgeable. So there are many things to consider, and ventilator is just one aspect. There are many other disposable issues that relate to caring for a patient who is already ventilated.
Okay. Wow. As we wrap up, one of the questions that a lot of us are trying to grapple with is looking at what's happening in Spain, Italy, UK, the States. It's scary. Do we have capacity? If it blew up to those numbers, do we have capacity, or are we doomed?
The straightforward answer to that question, I don't think we would, because if in America they do not have enough masks and so on, they do not have enough ventilators, they do not have bed space, we certainly are a lot worse off.
Yeah.
But probably because a bulk of our people live away in the rural areas and so on, they have a little bit of space. That may be our saving grace if we observe simple, basic things that we are being told to do.
Yeah.
If we stop waiting to see a sick person before you believe, I must put my finger in that.
Yes.
Where the nail went through. You must.
Yes. Unless I see, I will not believe.
Yeah. So I think that our bigger issue is health system issues and very many informal sector where people stay congested and so on. How do you do with them? The daily wage earners, what do you do with them when you lock them up? They don't have enough food and so on. I think our challenges are myriad, particularly. But we also have a relatively young population.
Yes.
Is that protective enough? Say, don't bank on just your youth. Please take care of yourself using the basic things: the hand sanitizer, soap and water, social distancing, wear your mask, and don't be in places you do not need to be.
So, Daktari, our time is up, but I'm so grateful for your time this morning and for the information you've given us. I believe we have been helped, and we look at things a bit differently now.
I do hope so, Pastor James, yes.
We may call on you again, depending on how this thing stretches out.
Thank you very much.
We may call on you again.
Thank you very much.
Well, I hope that information has been beneficial to you. I hope you've learned something that will help us to continue to work together and to cope with this virus and to overcome it, because we must overcome it.